Hi, my name is Mullner. I'm going to talk about my study, Gender Differences in Internalizing Problems and Everyday Behaviors Associated with Executive Function in Children with Autism. Autism spectrum disorder, which I'll be referring to as ASD in this presentation, is a neurodevelopmental condition characterized by difficulty with social communication and interactions, along with the presence of restricted interest and or repetitive behavior. Children with ASD are at higher risk of experiencing many challenges and stressors than their neurotypical peers. Due to their social difficulties, such as experiencing isolation and being a victim of bullying. Because they have significant stressors and social challenges, it is reported that children with ASD are at high risk of developing internalizing problems, such as anxiety and depression. Anxiety and depression in ASD are also associated with worsening of ASD-related symptoms and increased risk of experiencing negative peer interactions. Thus, it is critical to investigate risk factors associated with their internalizing problems. Prior studies show that executive dysfunction predicted anxiety and depressive problems in children with ASD, such that their impairment in executive function could be a possible risk factor related to internalizing problems in ASD. However, sampling biases were found in these studies, as between 81 to 91% of participants were male in the ASD group. Since a few studies suggested that there might be different presentations of ASD between genders, it is critical to further investigate gender differences in children with ASD. Therefore, the purpose of this study was to investigate gender differences in internalizing problems and everyday executive function among children with ASD. The study conducted secondary data analysis using de-identified neuropsychological assessment results. 59 data were collected for this study using the convenience sampling method. I conducted two separate one-way multivariate analysis of covariance to investigate gender differences in internalizing problems and everyday executive function. For the analysis, age, IQ, and ASD severity were treated as covariates, as previous studies show that these variables were associated with internalizing problems and everyday executive function in ASD samples. The results of my analysis show that there was no significant difference in levels of depressive and anxiety problems between gender. However, there was a significant difference in levels of behavior and emotion regulation problems between gender. A separate univariate test on the variables and post hoc analysis further revealed a significant gender difference in behavior regulation, but not in emotion regulation. Although the study found no significant gender differences in anxiety and depressive problems, there was a significant gender difference in behavior regulation problems, and girls with ASD especially struggle more with behavior regulation than boys with ASD. Thus, it is suggested that there might be different presentations of ASD between genders. Previous research hypothesized that some females with ASD develop coping mechanisms called camouflaging. Camouflaging is coping strategies for social difficulties, such as forcing eye contact and conversations during social interaction with others to hide their ASD symptoms. It is reported that more girls with ASD use camouflagins than boys with ASD. Therefore, some researchers argue that camouflaging might contribute to the missed or late diagnosis in females with ASD. In conclusion, since this study found gender differences in behavior regulation problems, it is critical that clinicians to understand different perspectives and unique presentations of ASD symptoms between gender. Clinicians also need to evaluate other factors, such as emotional and behavioral problems, that could significantly affect intervention decisions. For future studies, researchers may further examine gender differences using a larger ASD sample. It will be also interesting to see if gender differences exist in the effectiveness of an intervention targeting executive function. Lastly, future studies may investigate if the use of camouflaging is contributing to their behavior regulation problems in girls with ASD. I'd like to thank GPSA for sponsoring this presentation.